I'm Robin. I'm one of the hygienists here at Dr. Cohen and Schwartz's office. I'm here to talk about one of the most frustrating and guilt-producing things that we see in dentistry, and that's flossing. I know flossing is very technique sensitive, but I think I can show you enough things to make it really easy. At least easy enough that you can do it every day. I've watched thousands of people floss, and I know the problems that most people have. And the first one starts right out of the box by people not taking enough floss. You need about 2 feet of floss. I'll tell you why in a minute. The second thing people do is not hold the floss right. This is critical to being able to floss well in the back, especially. Wrap the floss around your middle fingers. This will leave your first fingers and your thumbs free to maneuver the floss. It's very, very important. You can see I have almost all the floss wrapped around one hand. That's so that as I use this piece of floss, I can only use this piece of floss between 2 or 3 teeth. Then it's going to get dirty, shredded, and so forth, and that's what causes most breakage of floss. So try to avoid that. You just unwrap a wrap off here, wrap it onto the other hand when you need a new piece of floss. So to put the floss in between your teeth, you just seesaw back and forth very gently. You don't try to pop it through. If you seesaw it back and forth, it'll separate into separate strands, and it's wonderful. It goes in like butter. Once it's between your teeth, you bend it around the side of your tooth like this, and you scrape up and down. That's because you're trying to clean the plaque off the entire side of your tooth, so it has to be an up and down motion. Just 2 things to remember. When I'll do it on this side, you have 2 teeth to do in every space. Make sure you go underneath your gum line as far as you can go. You can see right down there. And make sure you move both fingers up and down. Here's what happens if you just move the outside finger. Nothing. That's literally flossing. You just do that on every single tooth. In the back, to bend it around the side of your tooth, you either just pull it forward towards the front of your mouth or towards the back of your mouth. That's the only difference. They say that regular flossing increases your lifespan by about 7 years. That's a tremendous payback for just a little effort. Thanks.